What was your reaction listening to Dr. Berwick describe his own encounters and fears as a patient in the healthcare system? Did any of his experiences resonate with you? Our next topic is professions working together, synchronous and asynchronous collaboration. Now that we have discussed the roles and responsibilities of patients and providers, we will move on to discuss strategies that can help healthcare teams do its work. It's important to understand our settings of care in order to collaborate effectively as a team. Our settings of care delivery can be varied and include formal settings, such as hospitals or clinics, as well as less formal settings, such as a patient's home or school-based centers or their local pharmacy. The complexity of delivering healthcare will vary with the setting. Effective collaboration of the healthcare team is essential and will be influenced by the team membership, the setting, and the reason for the team encounter. The dark blue region in the diagram represents the intersection of the setting and team, and this is where the process of collaboration occurs. Often the team members are able to convene face-to-face, which can allow for active input from all participants. Examples of face-to-face meetings include ward rounds, team discharge planning meetings, or a clinical huddle. Technology can also facilitate face-to-face team meetings, for example, by using computer-mediated web conferences. These face-to-face encounters can be formal or informal and are effective when there is a clear agenda, pertinent discussion, and a summarization of what was agreed upon by the team. The advantages of face-to-face or live media-facilitated collaborations are that they occur in real time, allow for spontaneous and interactive conversations, and display both verbal and nonverbal communication to all participants, thereby lessening possibility for misunderstandings. In this video, you will see a team meeting occurring in a hospital conference room to plan for the discharge of an infant named Michael who had been hospitalized for pneumonia. The team includes the nurse practitioner as the primary provider overseeing Michael's care, the staff nurse caring for Michael, and the pharmacist. As you view this video, reflect on whether the needs of the key stakeholders are being met. What strategies are used among the team participants to effectively communicate a care plan for Michael?
So our next child is Michael, the 3-month-old little guy who was here for pneumonia. He's about to go home tomorrow with Mom, and I wanted to review our plans. When I checked in with Mom earlier, she said she couldn't be here for today's meeting, unfortunately, so we will need to get her up to speed. Lori, do you think you could give her a call when we're done to let her know what we talked about?
Sure. I'll be happy to call her when we're finished. I've been taking care of him for the last few days, and she's been doing his care and doing a really good job. She's coming in again this afternoon, and we're going to finish going over his discharge instruction.
Perfect. So one change for Michael from before this admission is that he developed some wheezing, and he's now going to go home with a nebulizer and a bronchodilator, in addition to the other meds he was on. What's the status of our teaching about this?
So I called the mother earlier in the week, talked about all of Michael's medications, reviewed for drug interactions. There's no drug interactions, but if possible, I'd like to meet the mother in person to go over proper use of the nebulizer, what to expect, and any side effects.
So she'll be here around 2 today. Would you like to make an appointment with her, or do you want me to page you when she gets here?
If we can make it at 3:30 this afternoon, that'd be great.
Yeah, that'll work great. He is up for a feeding about that time, and that'd be a perfect time for her to use the nebulizer equipment real time before she's discharged tomorrow.
This sounds like a great plan. Are there other things we need to be sure to put in place before he goes home? I called in his prescription yesterday to the local pharmacy that Mom uses, and she's to bring these meds in with her when she comes in later today. The nebulizer equipment is here. It's at the bedside, and the equipment rep left her contact information at the bedside as well.
It'd be great if you give me the name and number of the pharmacy again, just to have it in my notes.
Sure. It's Glendale Pharmacy on 1st Street. And the number is 555-4020. His feeds are going well, and Mom knows how to mix the formula. She has a month's supply at home, and they carry it at the Glendale Pharmacy also, so she won't have trouble getting it later on. She's been giving his oral meds many times and seems very confident doing this, and we've created a chart so she can check off the meds as she gives them each day. Dad's coming in, taking off work tomorrow morning, and they should be able to get out of here before noon. And I think the drive home takes about 2 hours, so they're going to stop along the way and take a break.
That's a great idea. Okay, great. Well, I have him scheduled for a follow-up appointment with his regular provider next Tuesday. The pulmonary specialist couldn't be here for the meeting today either, but does want to see Michael in the clinic at the end of the month. I'll send a message to reconfirm this with him when we're done, so we can let Mom know all of these final appointments before they leave tomorrow. Sometimes the pulmonary specialists want another chest X-ray, for example, so I can get this ordered in advance if needed. Mom and Dad both attended a CPR refresher course over the weekend, so I think we're all set. Anything else that I haven't thought about that we need to talk about with Michael?
Sounds like a wonderful family.
Great, and a wonderful little guy to be finally going home. Good work, team. Okay, well, let's now move on to Anna. So Anna's our 3-month-old who's recovering from her minor surgery that she had last week. How things?
Hi, Gina. It's Lori calling. I just met with your nurse practitioner and the pharmacist to talk about tomorrow's plans. The pharmacist would like to meet with you today around 3:30. Are you still planning on coming around 2? Great. He wants to have a chance to meet with you and go through, make sure you're comfortable with the new medications and the new equipment. Does that sound okay? So the nurse practitioner is going to be double checking with the pulmonology group about Michael's clinic appointment for the end of the month. And she's going to give you your appointments when she sees you later today. It sounds like everything's set for tomorrow. What time will Martin be coming tomorrow? Oh, that's great. 8 a.m. is good, and he can help you get packed up, answer any questions that he might have when he gets here, and we can get you out before noon. Are you good with that? Okay, great. I'm going to see you around 2. Your room is ready, and I'll see you later. Bye.
Since Michael's mom wasn't able to attend his team meeting, Michael's nurse was designated to contact Mom and convey what was discussed during the team meeting. In addition to a live assembly of participants, phone calls or web conferencing can be an effective means of conveying information to key stakeholders and gaining their input into decision-making. Some care planning may be best achieved through asynchronous strategies, such as when key stakeholders cannot be present for a live meeting, or when the conveying of information or request for response is not time-sensitive, or when additional information or consultation must occur prior to finalizing a care plan. Asynchronous collaboration allows for flexibility when communicating, thoughtful reflection before responding, and if appropriate, can be disseminated to other key stakeholders. Asynchronous communication is commonly facilitated by technology, such as email or online discussion boards, and all patient information must be sent in a secure manner in compliance with federal and state laws. Though convening a team planning meeting optimizes care planning, it is not always feasible for all key stakeholders to assemble at the same time and place. Such was the case for Michael's discharge planning meeting. Michael's mom was not able to attend, so a follow-up phone call was held between his nurse and Mom. An additional stakeholder, the pulmonary specialist overseeing Michael's care, was also not able to attend the meeting and needs to be consulted about the discharge plans before they are finalized. After the team meeting, the nurse practitioner follows up by initiating a consult through an encrypted mobile device and securely transmits it to the pulmonary specialist's email inbox. The pulmonary specialist accesses the message later in the day while routinely reviewing email messages on an encrypted device. The pulmonary specialist then sends a secure response to the nurse before the nurse's shift ends. This process has taken approximately 2 hours, but because it was not emergent, it was still an effective collaboration strategy for this situation. The key learning points for this section are that there are multiple strategies for collaboration. Whether collaboration is facilitated through synchronous or asynchronous strategies, each is important to assure the delivery of comprehensive, team-based, patient-centered care. Module 3, titled How Will Our Work Get Done, will discuss synchronous and asynchronous collaboration in greater depth, including examples of specific tools that can be used to facilitate effective communication. For our forum discussion question, in the team planning video, you saw some questions arise and some ideas that required follow-up before the plans could be finalized for Michael. What are additional means you might use to communicate with team members and stakeholders in order to ensure that an effective care plan is developed?